my name's Kimberly. I'm going to be your nurse today. We are going to do trach suction for you. If you don't care to give me your name and your date of birth. Great. All right, do you have any allergies? No. All right, do you have any pain right now? No. Great. All right, before we get started, I am going to listen to your lung sounds. Okay, so you are sounding a little congested, so we will get that suction for you. Have you ever been suctioned before? You have? Okay, great. All right, I'm just going to check your pulse ox. Great, it is at 98. Okay, so I'm going to go ahead and turn on the suction. I'm going to turn it up to 150, no more than 150 for an adult, and then I'm going to turn your oxygen all the way up. Okay, if you don't care, take a deep breath for me. Great. Okay, at this time, I'm going to go ahead and do hand hygiene, and I'm going to go ahead and open up my supplies away from me. I'll just throw this in the garbage. Okay, so now I'm going to go ahead and get my saline out very carefully. Actually, I'm going to get my drape out first. And I'm going to treat my patient. Okay, now I'm going to go ahead and get my saline. Okay, all right, I'm going to unscrew the cap lipid. I'm going to come around from the side and I'm going to pour some in, cap it, and just set it aside. Okay, so before we put our sterile gloves on, I am going to put my PPE on. Actually, before we put our PPE on, I'm going to go ahead and open up my section. Just be very careful, it does not touch. Great. Okay, so now I'm going to go ahead and put my PPE on, which will be goggles and a mask. Okay, now that we are ready to get sterile, I'm going to grab my gloves. And I'm going to do hand hygiene one more time. Make sure I keep my hands above my waist. Alrighty. Now that we are ready to get started, I'm going to go ahead and get my suction catheter out. And do want to be very careful and keep our end of this that will go down into the trach very sterile. I'm going to go ahead and hook up my section. I'm going to test it. And then I'm also going to test it in the saline as well. Okay. There we go. Okay, great. I'm going to go ahead and test it in the saline. Great. Okay, now with my dirty hand, I'm going to go ahead and reassess my patient's oxygen. It is still at 98. I'm going to go ahead and remove their oxygen. I am going to very carefully, and then if you have any respiratory distress during this, just let me know and we'll stop. Very carefully go in. I will suction on my way out, no more than 10 seconds. Great. I'm going to go ahead, clear my line, and then if we needed to do a second pass, we would. In this instance, we are not. So I would wait 30 to 60 seconds in between my passes, and I would do no more than 3 in 1 hour. So at this time, I'm going to turn my suction off and I'm going to turn my oxygen back down. I'm going to put my oxygen back on, and we are going to dispose of this. Okay. Okay, I can go ahead and take my PPE off now. I'm going to do hand hygiene. I'm going to assess my patient's pain. I'm going to check their pulse ox. I will reassess their lung sounds. Okay, they are sounding much better. And we would assess their pain, listen to lung sounds, check their oxygen level. I would have them cough and deep breathe. And I would clean up my area. I would report, record, and evaluate. Thank you.